Welcome to the Creighton University CPHHE Mental Health Podcast. My name is Monica Lewis, and I am a mental health practitioner. And I have two co hosts with me. I'll let you guys introduce yourself.
Johnny No Good,
And you are with.
Beyond the Stigma neighborhood grassroots organization.
And then we also have.
Yeah, my name is Peyton Hogan. I am also a licensed mental health practitioner. Been in the game since 2019.
All right. Welcome, welcome, welcome. So we are here today to talk about depression. And you got three great people here today to be able to shine light on the topic and really just do a deep dive, casual discussion about what depression looks like, feels like, and how, we can deal with it on an everyday basis. So when you think about depression, guys, what do you think about? What's the first thing that comes to mind? What would you say?
Yeah, I'm not doing the things that I normally would do. I think that's a sign of depression that most people don't correlate to depression. A lot of people think depression is just like, oh, I'm feeling like this. But it really is like when there's a behavior or there's an activity or there's something that I normally will partake in on a consistent basis that all of a sudden I no longer have the desire or the want to do, right? Like as a clinician, we call it diminished interest in a particular thing. And so like when I start to see that I'm having diminished interest in things that I used to find enjoyment in, that's a huge sign. And especially with the clients that I work with as a therapist, like where I'm like, hey bro, hey sis, you might be depressed here. So I think that's one of the biggest ones for me.
Okay. Yeah, I think for me, I think about all of the different classifications. There's different types of depression. So I'm thinking about bipolar depression. I'm thinking about postpartum depression. I think it's a bipolar type 2 depression. So I'm just thinking about all of the different classifications. But to go back to what Peyton was saying, I think about diminished interest. Are you not having enjoyment out of things that you normally would do? Are you not keeping yourself up? Is it harder for you to get out of the bed? And I think on our last episode, we was talking about like the spoon theory and stuff like that. So are you then finding it difficult just to get out and brush your teeth in the morning or whatever it is? So depression looks different for different people, but there are common warning signs that we could see that, okay, this might be depression.
Absolutely. So when we're looking at depression in and of itself, you're right. There is several different types of depression. And I think the most of the time we're seeing people that are either clinically depressed, right? They have major depression disorder, or they have postpartum depression. There's seasonal depression. So there's different types of depression that people can deal with. When we're looking at like our bipolar disorders and our bipolar type 2 or our schizoaffective disorders, those are more of a mood instability that has depressive episodes that goes along with it. And so does anxiety, has a little bit of depression that goes along with it. We kind of can find depressive episodes within many diagnoses, wouldn't you say, Peyton?
Yeah, 100%.
So I think that when we're looking just at depression, what you said makes so much sense. Is going back to that spoon theory. And I think that spoon theory, didn't it start with medical diagnoses at first because they were noticing that people were struggling to just be able to manage just doing the smallest of things. And so by time they would get through just getting up and going to take the shower, they didn't went through 2-3 spoons. And that in and of itself was triggering then more depression,
So what would you say, what is depression, right? Like I know we didn't gave a definition. What are some of the things that you would say, both of you, that y'all would say kind of cause depression or things that can lead to depression?
I think it's like we could look at it from a clinical standpoint, right? Where with a clinical standpoint, I believe it's a period longer than 6 months that you experience a certain amount of symptoms, and it's at least 5 of 9. There's going to be like diminished interest or enjoyment in things. Again, like I said, like you stop doing things that you used to do. You experience like some sadness more often than not. And there's a couple others that are not coming to me right off the top of my head. But a lot of times, like, people don't realize that sometimes I might be feeling depressed doesn't necessarily mean that I'm experiencing clinical depression.
Absolutely.
Right? Because being depressed, that's an emotional experience, and an emotional
Absolutely.
experience is 100% okay. And so I think it's big to know the difference between just feeling depressed or feeling down and actually experiencing depression.
Right.
Right? Because if I'm just feeling depressed, I might be going through like some type of what we would call an adjustment disorder. Like I'm adjusting to a different situation in life. I just broke up with somebody, and so now I'm trying to adjust to this new normal, as opposed to somebody who had broke up with that person, but then they got stuck in the symptoms for a long period of time. Or when we think about the formulation, a lot of times what's not talked about, especially like in the Black community, is that a lot of our depression comes from PTSD symptomology that goes undiagnosed, right? We experience like significant traumatic experience and we never actually deal with it, which means like my PTSD symptoms go unacknowledged, but now I see the depression symptoms, but I never really identified like the actual root. You get what I'm saying?
Oh, absolutely.
Yeah.
Absolutely. So I think it's important for us, like you said, to identify the fact that there's sadness and there's depression. So there's moments where we are actually just sad. Like, dang, that just happened to me. That sucked. Like somebody just stole my car. I'm sad. You know, I'm down. Like that was my favorite car. And so we have moments when things happen that we just are sad and we're just depressed at that moment. And so having moments of depression is normal. And I think a lot of time we don't recognize that that it's normal to have low moments. It's just not normal to stay in those low moments. It's not normal to stay beyond 2-3 weeks in those low moments. It's not normal for us to stay in there 2-3 months in those low moments. That's when, or 2-3 years in those low moments, that's when we need to be seeking help and saying, hey, I need to talk to somebody. So how do we recognize that? How do we know when these low moments have gotten too far, right? Well, you guys mentioned, well, number one, we have the times when we don't want to get up. We don't want to really put ourselves together. You noticing that the person that was coming to work dressed to the nines is no longer doing that. They just throwing on a t-shirt and some jogging pants and some flip-flops and coming to work. Hair's not taken care of like it was before. Now it's just kind of up in a bun or wherever it is. That's a sign, especially if it goes on for more than a couple of weeks, right? We have the person who suddenly is calling in to work. I can't go. I don't feel good. It goes from I don't feel good to I don't know what's wrong. I just don't have any energy, right? They're not even able to even pick up the phone to call somebody. People are coming to the house. I don't really feel like it. Oh, how you doing? I'm good, but I don't really feel like company today. All right, well, hey, it's your birthday. I thought you wanted to go. I'm okay. I just want to stay home.
Yeah.
So everything in their life is now kind of shifting around and beginning to look different. And once a person kind of stays in that mode, they go deeper and deeper and deeper and deeper into those negative thoughts. Those negative thoughts begin to just kind of circulate and begin to pull them down further and further and further.
Yeah, so I think you hit on a major part of what I've understood about depression and even leading into anxiety is the thought of rumination. So could you kind of both of y'all talk about like how does negative thoughts play into people experiencing depression or feeling depressed and kind of like some of the feedback loops that come from self-fulfilling thoughts and stuff like that can kind of perpetuate the symptoms of depression?
100%. First thing I want to address before I get to that, I gave out a stat and the stat was not accurate. I was thinking of PTSD. PTSD is 6 months. The transition between adjustment disorder and PTSD. For depression, it's a period greater than 2 weeks. And that just came to my mind as we sitting there talking. But the thought cycle, so like when we look at a therapeutic approach such as like cognitive behavioral therapy, which in sense, like when we hear that name cognitive, it's all about our thoughts or our cognitions, behavioral therapy, how our thoughts impact our behaviors, right? Like everything starts with the thought. And so when we see people who are struggling with depression, getting stuck in these maladaptive thought cycles, we call those cognitive distortions. And there's a long list of cognitive distortions that we can go through that all of us, like you, me, who's behind the we all have cognitive distortions. They're 100% normal. Where they become abnormal is when we start functioning off of the cognitive distortion and we start allowing those to become truth and we don't challenge them. Right. So an example of a cognitive distortion would be all or nothing thinking, where it's like, I can only do this and it can't be anything else. Another one is should statements, like I should be further in life. I should be doing better. And it's like, that is not rational thinking, because we're placing these unrealistic expectations. And when we look at people who are depressed, they are struggling with challenging or restructuring a lot of the distortions that are at play in their life. And so typically it comes from this thing known as a core belief, right? Like how I identify as myself based on my past experiences, right? Like if I was a kid and my dad, like I like being around my dad and we work on things in his shop because my dad liked to work on things in his shop, and I mess something up and my dad like, hey, sit down, like get away from my stuff, right? A core belief that I could have is I never do anything right. I always mess up. And so now my distortions will all play off of I never do anything right. I always mess up. The thought processes that come from that. And so like I look for every moment and every opportunity that I can validate that core belief that is negative in my life, causing me to become stuck in that loop that we're talking about right now.
Unhealthy thinking styles.
Exactly.
Yep.
That
was smiling.
I felt that. That was a mic drop.
That was a mic drop right there.
Yeah.
No, but those unhealthy thinking styles really do kind of manifest within the depression within the person who's dealing with depression. And so like some of those unhealthy thinking styles would be like magnification, you know, where they're magnifying everything that, you know, the smallest thing, they're making
everything the end of the world.
Yeah, that making it a big thing, you know. The mind reading. Well, you know, I know they don't like me anyway, and so therefore, you know, I'm just not going to get the position, you know. It's those type of unhealthy thinking styles that keeps a person trapped and feeds into those core beliefs that they already had.
I think a big one for people who are depressed is personalization, where like they personalize every experience. So like if I do anything, they'll probably think I'm weird, and so like I'm awkward. So then I don't do any. I make this whole experience about me. Therefore, I'll remove myself from the experience.
Okay.
And I think we see that with a lot of people who struggle with anxiety and depression, because now it's like that negative thought process. It kind of sucks their self-confidence dry, because now I don't have any internal locus or internal belief in self, right? And when I don't have an internal belief in self, I'm looking for external validation. But when I'm depressed, I'm probably not getting the external validation.
Right.
So now I'm stuck here.
Yeah, right. And that's the reason why those positive affirmations are so important. And just being able to speak into yourself those positive things. You talked a little bit before when we were on last about the rice. You want to speak a little bit more about that?
Was talking about the rice experiment conducted by Dr. Emoto, and how, you know, that the water, the way that it would crystallize would change depending on if a person was speaking positive words versus speaking negative words. And he did a rice experiment, which he put labels on bag of rice, good, bad, and neutral. And the rice that had the bad label on it, it went bad and spoiled quicker than the rice that had the positive labels on it. So being like that, we are 75% water. I think it's super important that we be mindful of the labels, not only that we identify and put on ourselves, but what type of words are we speaking onto ourselves. You know, so that was kind of a little bit about the rice experiment.
But even when we think about that in general, how does it make us feel when we talk positive about ourselves versus saying something negative?
That part.
Like, you know what I mean? So if you're a person who's struggling, with depression and you're holding on to negative beliefs about yourself and you're often speaking it to yourself, how would that be for you on a daily basis? You
Yeah.
know, I'm too fat to even go there. I don't even what would be my purpose of going? I don't want to wear that because it makes me look away, and I don't want to sit there. If all of those negative things are constantly on your mind on a consistent basis, how might that make a person present?
Yeah.
Yeah.
So
You
I
know.
think you hitting on something key. Last week in one of my classes, we did an activity where I had the students pick a random student from the class and tell them something that they admired or liked about them. And every time a student was chosen, you literally could just see a weight being lifted up out of them
Exactly.
when they heard positive things about themselves. So sometimes we're so close, the personalization that you was talking about, we're so close to ourselves. We know our shortcomings. We know all of our faults that we believe everybody else around us see those same exact faults and shortcomings.
Exactly.
Bro, I don't know your side tooth missing unless you smile too
Unless
much.
you
You get
show
what
it
I'm
to
saying?
me.
Bro, I
We
don't
don't
see
even
the little, I
care.
don't even see the little brown, and really I wasn't even thinking about you. I'm thinking about what I got going on. So I think small exercises like that, just speaking life over people and over groups, it has so many magnificent effects. I think that it's important to keep that in mind. It don't have to be complicated.
Nope.
Literally, if I was just to be like, hey, Peyton, bruh, hairline crispy. I like the way that you got yourself together. Look, bruh, body language
Body
already
language
perked up
already
just a
perked
little
up.
bit,
Just
you
from
know?
there,
So
right.
it's all about being able to recognize that we are all human. We do all kind of deal with these cognitive distortions that you was mentioning, and it's pretty common. Now, can either one of y'all kind of tell us how common is depression? Like, what are some of the stats on how common depression is?
I think I got something right here, man. So currently for people ages 12 and older, there's about 13.1% of people who have reported depressive symptoms in the past 2 weeks. I think depression is very common.
very common.
But there are a lot of people who are undiagnosed, people who won't go in and report their symptoms, and everything is all good. You know what I'm saying? I think that that's something that is very common amongst a lot of us. We won't talk about what we actually feel,
Right.
but when we have the time to sit back and reflect, if we ever give ourselves that time,
Yeah.
I think a lot of us could probably classify as being clinically depressed. A lot of us.
Would you say, Peyton, that depression even cycles?
Yeah, it does. There's multiple types of
it
clinical
cycles.
depression. Yeah.
It cycles. So a lot of times people who suffer from depression, some days they could just be fine. They could be happy. They could be ready to go. Not your I'm just overly, hype.
Not manic.
Right. Not your manic, not your grandiose kind of behavior, but just your normal feeling of ready to go, just your normal kind of level of being. They can be fine for a few days and then go into a low mode, then go into a depressed state and stay there for a few days. And they can cycle like that when it's unmanaged.
They honestly can be fine for a while.
They could be
Right,
fine
like-
for a few months even.
Yeah,
and then
because
go.
the difference between their single episode and then recurrent, in order for it to be recurrent, there has to at least be a period of 2 months where you don't experience any type of depressive symptoms. So depression is like, I like to explain it like this. It's like a cloud, right?
Sure
a cloud
is.
that has a storm, and the storm is gonna rain, it's gonna pour, you're gonna be inside, you're gonna see the thunder, might be a tornado, but eventually that storm is gonna pass.
Right.
You know what I'm saying?
Right.
But just because the storm passed don't mean another one ain't gonna come.
Right.
It's the same thing. And depression is not a end all be all either. It's just about, do I have the skills to weather the storm that is ahead?
Absolutely. It's the resilience. Yep, absolutely. Absolutely.
So I've noticed you mentioned resilience before. Kind of, could y'all speak as licensed therapists? How do y'all identify functioning depression within some of y'all clients, or have y'all identified functioning depression? Because I think that that's a common misconception as well. You talked about reoccurring depression and people making it through one storm, getting to the next. How easy is it to be functionally depressed? And then how do y'all identify those symptoms within people? And what are some of the strategies and tools to help people weather those storms of functional depression?
Well, I would say, just going off what Peyton was saying, when we're dealing with people who can go 2-3 months without an episode and they're not taking any medication, they're more of your functionally depressed people. Okay. For people, like I mentioned, that had 2-3 days and then they go back, those are more of your major depressive people. They're struggling every day. Every day it's a struggle for them, you know. To talk about how, and when I say every day is a struggle for them, I mean every day is a struggle for them. There's days that look better and there's days that they're feeling good, but every day is a struggle for them, especially if they're not managing anything, whether that's taking any medication or using some type of behavioral kind of plan to kind of help them to manage it. So what would that look like? If I'm a person who's suffering from depression and I don't want to take any medication and I want to just try to help myself, I'm going to have to be able to identify a full plan for myself and have others help me, because you're going to need people to pour into you when you're feeling low. So imagine me being a cup, okay? And my cup is probably like a fourth full, right? I need to try to keep that glass halfway full. So when that cup is a fourth full, we're almost on E. That's when, with your spoon theory, that I'm on one spoon, okay? So I need to pour into me in order to help me to get out of this depressive state, right? So I've got my list. My list says when I can't get out of the bed, I need to lay there and I need to think about something positive. So I'm stuck. I don't feel like getting into bed, and my mind is saying, Monica, just lay here, just lay here. I'm going to look up and I'm going to think about the fact that I opened my eyes today. That's a blessing for me to open my eyes. I can move my body. Oh, that's a blessing. I'm grateful that I can move these things. I could put them on the floor. Let's see me put them on the floor. I could put them on the floor. Okay, let's see me stand up. I'm going to talk myself through these things. Once I'm able to get myself to just talk myself through these things and get up and think positive about that, then I can start the next thing. Now let's go to the bathroom. Yeah, let's try to get in the shower. I'm going to talk to myself, go through this plan, and I'm going to talk through each thing to try to help myself get through it. Now, some people would say, Monica, I can't even talk myself through it. I lay here. I can't even get out of the bed. I lay here. So set a timer. I have them set a timer on their phone. Have you ever done that? Had them set a timer. You wake up at 6 a.m. and you know you want to get out of the bed by 10. Set that timer at 8:30. Set the timer at 9:15. Have it play a song for you. Those are little things, but they mean so much to people who struggle, especially if the song that they put on is a motivational song.
Right.
You know, it encourages them to get up and get going. Then having that plan, list things that they love to do. Maybe when they go to the bathroom, it's hard for them to get in the shower. So again, they're talking to themselves. They're speaking positiveness into their self for them. Okay, for them to get in and get going and doing what they have to do. And we just go down that list, you know, making themselves something to eat. You know, you may not feel like it, so have ready-made food in the refrigerator. Get it, warm it up. You know, make sure it's disposable so you could throw it away. So you don't have to worry about doing dishes, because dishes is a struggle for you. Little things like that.
Yeah.
Because otherwise, what happens when a person is depressed, they may make something to eat. And what happens with the pots and the pans and the dishes?
Don't never get washed. They stay in that sink.
But if I know that I'm trying to manage this and I want to be in control of this, let's look at how we can do that. Now, as a clinician, my job is always going to be to see whether or not you can do it without medication, and we can just do it with the behavioral plan. If we can do it with the behavioral plan, then we're going to work together and figure out everything that I know that you can possibly do to help you. But when that seems like it's struggling, we have to go to something. We got to go to plan B. Plan A is going to be to do it your way, but it takes you as the person to do it, right? Because the healing always has to start with you.
Okay.
That's my plug for my card, by the way. Lewis Counseling, let the healing begin with you. Anyway.
I love that.
But so it always has to begin with you. But then if it's not going the way we want it to go, then let's look at plan B.
Okay.
What would you add to that, Peyton?
Yeah, I was just about to say, like, the goal always is to have an individual be able to behavioral modify on their own.
Right.
That's always the goal. But that takes a whole lifestyle change, and a person has to be willing and they have to be committed to the lifestyle change. But sometimes
It's just not.
the chemical levels just ain't there.
It's not there.
Right? Your dopamine is completely depleted.
Right.
Your serotonin levels are all jacked up. So
Fourth of a
you're
glass.
up all night and you want to sleep all day. You know what I'm saying? So it's like at that point, I highly encourage people not to be afraid of medication.
Absolutely.
Be cautious.
Right.
Be cautious, but don't be afraid, because
Right.
people will be quick to pour something into their mouth that change the whole anatomy of their brain pattern. They'll be quick to you know what I'm saying? Quick to do a couple of other things that'll change the framework of the mind. But then it's like, you can take something that you know will level out the chemicals that you need possible so that you can get functioning day to day. And it's like, nah, I'm not about to, no, it ain't about, and it's like, chill out. Take it so that you can equip yourself with the skills and get back to a baseline so that you can function at the capacity that you need to. And then with some people, you can wean off of it.
You sure can.
Because it's not the medications for most
Right.
mental health disorders, not all, because there's some where if you ain't taking that medication, you about to be telling me you see two of me right here.
Right.
And that's a whole nother story.
Right.
But it's like,
But for people with depression.
yeah, for people with depression, the purpose is not to cure your depression with medication. The purpose is to bring you to a baseline so that you can get the skills to function daily and eventually get back to normal self.
Okay.
And those skills might be doing some cognitive reprocessing. It might be, looking at, different ways that person is thinking, having them do mindfulness exercises, just all kinds of different things that we can do. The best modality of treatment that I have found working with depression has been CBT,
Okay.
which is cognitive behavioral therapy, which is really looking at just kind of restructuring those cognitive thoughts.
Yep, challenging those thoughts, 100%.
For sure, for sure. I definitely do appreciate, like the mentioning that y'all try to look at other types of treatments before just automatically going to medication. And I love the fact that you talked about having a behavior plan where it starts with baby steps. Brother Peyton, I know that you do have a platform. Your platform is called Clean Your Room.
Yeah.
And I feel like it kind of hits at those basic kind of starting points. If you could, as we get ready to wrap it up, kind of talk about what was the inspiration behind that, and like, is it as simple as just cleaning your room? Does that change the capacity for people? Does that set them towards a positive feedback loop and get some positive momentum to build and change? So kind of walk us through that.
Facts, 100%, man. So like, when we look at our lives, especially in the aspect of mental health, right? Most of the time, when we're struggling with mental health issues, there's chaos that we find, or disorder in areas of our life, and we're trying to regain control or order of those areas. And so like, when I'm working with clients, they're like, this isn't going right. I'm struggling over here. This is a mess. I don't have the job that I want. Like, my relationship is doom to doom to doom. And I always bring it back to, all right, well, what does your room look like right now? You know what I'm saying? And to bring it full circle with the topic of depression, when people are depressed, typically their room will reflect the way that their mind is functioning.
Absolutely.
And so it's like, if I want to start getting clarity in other areas, let me start with the most simplest thing. Let me control this thing right now that I have control over, which is my room. Let me pick up my room. Because when you start to pick up your room, it's an analogy, or it's a symbolism, right? I can't pick up my room all at once. I can't pick up my laundry, clean off my dressers, fold up my clothes. Like, I can't do it all. I have to take one thing at a time. And as I start to take one thing at a time, I'll put my clothes up and I'll clean this off and I'll make my bed. I do one thing after another and my room starts to clear up. It's the same thing with our minds. I can't attack everything in my mind all at once. I can't process through this trauma and go through this and learn this coping skill all at one time, but I can do one thing at a time.
Absolutely.
And if I take that time and do it, eventually I'll end up with a clean room. I'll end up with a changed mindset. So that's what the premise behind all of that is. You clean your room, you change your life.
I love that.
That part.
I love that.
That part. So it sounds like we had some misconceptions about what depression is, what it looks like in different people, kind of what are some of the different cognitive distortions that can lead us to depression, what are some of the easy baby steps that we could take at home as far as brushing our teeth, setting a timer to get out of the bed, just working on getting our feet to touch the floor, and even cleaning the room. And I love the analogy that you cannot clean your room all at once. So you cannot deal with the disorders or some of the neuroses that's going on within your head all at once. So it's about baby steps. So is there any parting words that we want to give our viewers, our listeners, as we get ready to head out?
Yeah, don't be afraid of mental health, right? Like if you are struggling, don't struggle in silence.
Right.
Talk to somebody, and the first person you talk to might not be the person. Don't be afraid to fire that person. Fire them expeditiously, and go get you another one. Go therapist shop. Ain't nothing wrong with that.
That part.
No, I don't think so either. No, not at all. And just looking at just the stigma of itself, recognize that even though you might hear that word depression, understand that we also said it's normal. It's normal. And you're not alone.
All right, so I think that's it. Make sure y'all hit the like button, subscribe, tune in for our next episode. I think we got some more things that's coming up that people's going to enjoy. But as for now, I've been your host, Johnny No Good.
Monica Lewis.
Peyton Hogan.
We out of here.
Out of here. See you again.